Supermarkets are getting bigger and bigger. The last few decades, they've started to resemble small cities. Maybe they're not as personable as they used to be, but today you can get almost any errand done while you're buying groceries. You can do your banking, pick up your prescription, and gas up the car. And now, the newest trend at the supermarket is to offer in-store nutrition counseling. Many food chains have hired registered dietitians to work in their stores and rub elbows with customers. It's true that you can find all kinds of healthy food information on the internet, but how does that translate into where I can find those foods in my local store? Phil Lempert is food trends editor for NBC's Today Show, contributing editor for Supermarket News, and CEO of the Retail Dietitians Business Alliance. He says as local food information has become harder to find, we need it more than ever.
Just take a look around. Everybody's heavy. More people with pre-diabetic conditions, more people with heart disease. What we're really searching for is someone to hold our hand and teach us how to eat better. We know for decades that we're overweight, that we need to eat better, that we need to exercise, but obviously it hasn't taken hold in our brains. So what retail dietitians are all about are helping us take that knowledge that we have and helping us execute it for the rest of our lives.
There are about 70,000 registered dietitians in the United States, but only about 600 working in supermarkets in direct contact with shoppers. Lempert says that number should double in the next 2 years. Some experts even call supermarket dietitians the rock stars of the industry. Chains have plenty of competitive reasons for hiring additional staffers with dietary certification and putting them out on the floor.
Supermarkets now have more competition than ever before. We can buy foods in dollar stores or warehouse clubs. Bed Bath & Beyond is selling food. Just about everyone is. So if supermarkets can offer a retail dietitian, they're building a better relationship that's built more on substance than just price. You can find out the information you want, and as a result, you're going to reward them by going back there week after week.
There's no universal blueprint for how dietitians operate in supermarkets.
It varies from store to store. Some of them, for example, ShopRite has a office or a corner in the store, and that's where the dietitian is. Other ones have dietitians just walking around the store. Some charge for some services. Some have all the services at no cost. So it really varies by each chain and what they're trying to accomplish. And also, keep in mind the demographics of a particular store creates different needs. For example, there's some ShopRites in the inner city of Philadelphia where a lot of the customers there don't even have health care. So the registered dietitian has become even more important to them to make sure that they're getting enough fruit and vegetables versus, for example, in an upscale area where they might be going to a dietitian just to work on a single aspect of their diet, which could be avoiding high fructose corn syrup.
The work of supermarket dietitians is about as far away from cookie cutter as you can get. People with special dietary needs can especially benefit from individual help.
It could be someone who has found themselves single after many years of marriage. It could be somebody who has a health condition. It could be somebody who's trying to save money and eat healthy for their family. What a retail dietitian can really do is dig down and understand what that person's needs are and then create a program for them on how to shop, how to prepare foods, and how to eat better. So each plan is really customized. Some dietitians have store tours for people who want to restrict sodium. Other ones have store tours for people who want to restrict their fat. So it really varies from person to person.
In fact, Lempert says there's no better place to improve people's eating than the very place they buy what they consume.
They absolutely love it. We know all this information. It's been out there for decades, but it hasn't connected. It hasn't had that light switch go off in someone's brain and said, okay, I know I got to eat better. What do I do? So to be able to have somebody in your community who's in that store day after day that you could go up to and just ask a question or that they could bring you over to a shelf is almost like a health concierge, if you would.
Store chains generally respect the ethics that registered dietitians uphold and the credibility they need to maintain in order to do their jobs. That's one reason why Lempert says it's important to be sure you're dealing with a registered dietitian and not someone who simply calls themselves a nutritionist. Even though the trend is accelerating, many of us still haven't had the opportunity to talk to a supermarket dietitian to find out what they can do for us. You can start by checking your local store's website or by asking your store's manager if they have a registered dietitian. You can find Phil Lempert at supermarketguru.com. I'm Reed Pence.